Thanks, Maggie.
Hi, everybody. Welcome to our Care Coordinator Monthly Info Share. And I just want to give people a few minutes to come into our Zoom meeting space. We have a couple of interesting things to go over today. I put on our agenda so you can see it. As always, we record the session, put it on our YouTube channel. And if you're attending here in our Zoom space, we send you an email that says, keep this email because it's good for 1 hour of continuing education for care coordinators. Today's theme, well, there's a few themes here. We have a tip sheet, a work in progress or almost finalized or perhaps finalized, that we'll present with you and interact about, and some information about documents for assessment, reminders to use the application checklist. We can take a look at those. And just touching base again about full lives and some basic reminders. Your team members here are myself, Kara, and Cassandra Lynch, and Damon Silva, your training team. And we're very happy that you're here, as always. First thing on our list here is the assessment tip sheet. And I'd like to welcome Damon to go ahead and interact with us about that. You can, if you want, you can go ahead and share. I'll stop sharing the agenda so you can drive the screen. So the tip sheet came about with the thought that, you know, our assessments, our in-person assessments are becoming more common. Of course, they're going to be happening for our initial assessments. And sometimes for our renewal assessments, they'll happen. We did have a brochure, but we thought that it would be nice to offer you a tip sheet that that individuals and families could learn more about what to expect. So that being said, that's the thought process around it. Take it away, Damon.
Awesome. Thank you very much, Kara. Yeah, so that pretty much sums up of what this tip sheet is intended for. Basically, with the changes, with the everything going back to, or majority of things going back towards in person and whatnot, and we know that this public health or with all this changes that we had, it lasted a while. So we thought it would be helpful that there are some tips and some reminders for families and individuals who are receiving services or who may be in the process of looking into receiving supports, uh, can have some form of document to kind of refer to as what are some helpful tips um, during this process. Uh, of course, there are a bunch of different checklists and forms that need to get filled out, and sometimes that can be, a little hectic since there are so many forms. Um, and so that's kind of why we rely on care coordinators to kind of be that helpful person to turn to for families and individuals to complete this process. So as you can see here on our screen, this is just very simple, plain language text as far as what's expected prior to an assessment. Um, who may attend these types of assessments, scheduling, as well as during the actual process. And we worked with the different assessment departments with this checklist as well to get some of their feedback and some of the common things that may occur while planning for or during an assessment. So some of the bullet points we have are kind of with reference to their suggestions as well. But as you can also tell, we also make reference to in situations where an in-person assessment couldn't be completed or is going to be difficult to complete, there still is that possibility of having a virtual assessment done. And if that's the case, then obviously we make pointers as to Zoom accounts, making sure that everything is in order before the assessment, so that way it's a little bit more streamlined for families and individuals. All right. So I'm not going to go bullet by bullet, but I'm just going to let you guys kind of go through it. And if you have any questions or input, feel free to put it in the chat and we'll get to it after I kind of introduce it as well. As you can see, it's broken up into nursing facility level of care, or NFLOC, as well as on our second page here, ICAP. All right. Now you might see there's a discrepancy as far as like, oh, the separation between NFLOC and ICAP and the different tips as well. This tip sheet, I would like to say is it's almost there. There's a couple things that we want to just get a little bit more input from our assessment units to make it 100% solid. But for the most part, this is kind of what we're aiming for, right? Plain language, simple, something that you can hand to a family and be like, this is kind of what to expect. Or as just maybe a reminder, like, hey, maybe, you're coming up on a renewal, or you're going to have to go through this process again. So here's some of the reminders, right? And yeah, we would love to hear some feedback, because this is obviously a tool for you all to help make your jobs a little easier, as well as the explanation a little easier for families and individuals. So if you have anything, feel free to chat it in. And it's okay. You can be as blunt as you want, right? I'm not going to get my feelings hurt. If there's something that's missing, or if there's something that maybe needs a little bit more explanation, feel free, and we can discuss it a little further. Kara, did I miss anything?
I don't think so. I mean, the thought of this is that we're just trying to help care coordinators help families participate in
Exactly.
assessments.
Yeah.
So we would love to have your feedback about this idea and about what you see. It's very close to being finished. I know that there's, the assessment and the process of assessment is a very interesting one. And there's just been so many different, different understandings around it. But we're trying
Yeah.
to get ahead of things a little bit and make a helpful document.
Yeah,
Okay.
and that's something I would like to point out as well, is because when I,
Hmm.
got started in this field, it obviously wasn't that long ago. This was peak, COVID era. Everything was virtual, everything was done online. And so my only experience personally was just the virtual aspect. And I know there's probably quite a few of you who's been in this line of work, even before all this stuff, and you're probably more used to the in-person side of things and how that looks and how that shakes out. And so we all bring different perspectives into, in this general area assessment and how that looks. And with us moving back towards that, maybe some people are more for it. Maybe some people are kind of a little bit more hesitant. I'm sure there are also newer people who have my type of experience where it's just virtual, right? So we want to make it that next step a little easier for everyone that's involved.
So here's some good questions in the chat or thoughts in the chat. And you can unmute yourself too. This is Zoom, so you can speak if you want, or you can write it in, whichever you want to do. A question says, why does the assessor ask environmental telehealth questions when the care coordinator has turned in the form prior to the assessment? They have a particular form that they go over when they're doing it, so they're probably on there. And my best thought on that, I would really have to ask the unit. But my best thought is in case something has changed, they can note that change. Not neither good nor bad, but they do have the Harmony-based form that they go through, so it's sort of hardwired into that. Suggestion says, can you have two different tip sheets, one for NFLOC and one for IDD, so we can give that to families? That's a great suggestion, because if they're going to have either or, make it available to you. Comment says, some assessors don't want others interjecting during the assessment, like a family member making a correction. Way back in the day, we used to teach to that, and we used to say, to limit attendance of people. And I guess, I don't know if it's accurate memory, but I remember folks having more struggles around that and talking about it with care coordinators about, people, I guess, interrupting an assessment, but they're trying to be helpful. Families trying to be helpful, and they're going to do that. I think probably a good thing to help our families understand is, they could state their concerns when the assessment is done or when there's a break or something like that, or they could ask the assessor, hey, my loved one doesn't really accurately represent everything. Is it okay if I say something in progress? We always want to be respectful. And it's different for everybody and different for families. I know there's some bottom line stuff when it comes to being respectful, right? I'm not talking about that stuff. I'm just talking about, if somebody wants to be helpful, maybe they could ask the assessor, how to best share that kind of information.
Yeah, and that was
Mhm.
honestly part of our discussion as well while we were brainstorming this tip sheet. As well, you can look at the who may attend section. And that was one of the points that were brought up as, all individuals here, right? We want to get the accurate information. They asked that, after a certain section or after the assessment is done, maybe we can add more or make corrections too. But like Kara was saying, as long as there's an understanding that at some point, like, oh, is it okay if I can step in and just add a little bit more? Because the whole idea is, right, to get the input from the individual who's going to be receiving these services, or if it's going to be like a legal representative or guardian or whoever speaking on their behalf, right? That's in order to get the most accurate response. And that is the hope. Not to say that, this person can be here, but they can't say anything, right? It's just, we have to inform it and come across it in a I don't want to say a respectable way or anything like that. I'm not saying anybody's rude when they interject or anything like that. But just waiting for an appropriate time to say, hey, I know we're kind of past that, but I'm gonna like to point back to this section that we talked about. I would like to add any input if that's okay.
Sure thing. Good suggestion here. Can CCMC also be included in the title for NFLOC? That's a good thought. And then agreement with Stephanie's comment, it might be nice to note which waivers each assessment is for, because sometimes families will forget. There's a lot of letters and acronyms for people. It's very confusing for people. So that would be very helpful, I think. helping people to feel less overwhelmed. Suggestion says have medication ready so people can sort of read off what it is their current meds are. We know those things change. You know, it's a picture in time, an assessment. But when they do ask, it's really helpful to have meds ready so they can state what they are, and to have your ID, your your ID card, and whatever you use for ID. Very good suggestions. We'll try to get some clarity about the form, the environmental telehealth questions form. I think I know which form that is. And it may be something about the, dragging something we used to do from the past into the present, and it's not consistent. The thought about telehealth has changed a lot with the advent of using Zoom. We used to have people go to a clinic before people commonly had Zoom. So that form's probably related to those practices. We'd have to look into that. Of course, we want to reduce duplication and the experience of duplication anywhere we can. And if it's possible, we'll do it.
Karen,
Yeah.
hi. Since you're gonna look into that, something that's similar is that the assessors always ask for ID. But we were trained to also include their ID with the application. And so I don't know if we still do need to include the ID. I always do. And I always say, well, it was with the application, but here you go. So if you could find out if we just don't need to include the ID anymore, that would be helpful. Or if we should still do it. And if so, then maybe connect the assessors with finding that document maybe, or completing that box.
I gotcha. Yeah,
Okay.
when we look at the checklists, I want to see if that's on the checklist. I'm not saying that, that what you're saying is I have an answer for it, because I just have more questions,
Right.
But I'm thinking, like, if it's on the checklist, then it's good, that's why people are doing it. And we're asking again, do we have access to that application, or are we asking because of reasons? And there might be. I mean, it's a detail I don't know. There might be. So
Right. Okay.
yeah,
Thank
I
you.
can look into that and the telehealth form. Just making a note here. All right. And then some suggestions: updating the ICAP guidelines with this information and writing it in a more accessible way would be good. Plain language is going to take some time to make our forms and our communications more plain language, but it's a great suggestion. I'm just making a note. Sorry, can't thinking right at the same time. Let's see. Information on if ICAP is asked for out of cycle, or if it is ICAP and then just a file review is conducted. Communication on the reasons is helpful. I think what the question is that folks would like to know if it's going to be a file review or an ICAP. ICAP is pretty regular. It's like every third year after a certain age. We do have this in our training materials. So, through age 7, it's on a I believe annual. Okay, watch me be wrong, right? But then after they turn 8, it's going to go to less. And then if a person's been in the system for quite a while, then I think that might be the person you're talking about, somebody who's been in there for a long time, and they are going to indicate whether it's an ICAP or not. So the behavior of the care coordinator, though, like what you submit, is the same regardless, but you would like a communication on if they're going to do an ICAP, when it's not on a regular cycle because of the person being in the system for quite a long time. That's what I'm getting from it. Great question. Okay, I've had assessors open to phone calls from POAs if the person is not an accurate reporter. Great. I think that's wonderful. you can ask, we could always say, hey, somebody has some info they want to add, that's okay too. Not everybody can accurately report needs or demonstrate needs or it's good. It's nice to have the help. Suggestion, I suggest to guardians and family to have a notebook and to write their notes down and add their concerns at the end. Great practical thought. I've always treated the assessment as a conversation. And that's true. An assessor has not complained. I'm not sure. I haven't heard of complaints about the conversation part. I think that's the general intent, just trying to find out from the person directly and through observation where they're at with their abilities and their needs for help. Included ID. Okay, some of us do include and some of us don't. Okay. Have a pen and paper handy when they need to draw the time or a clock. That's part of the assessment is they draw a clock or the time on a clock. Specific to ALI. You are correct. Good hint. Giving an estimated time window with fully understanding each case is different. So to put on the tip sheet, like this assessment might usually takes about an hour or something like that. We can ask our assessors. That would be good, I think, so people know. Does it say that already? Maybe it might.
It had some language like here under scheduling. An assessment could take up to 2 hours to complete, and that we want to make sure that we have an appropriate allotted time so that way that we don't have to we have to go through this appointment or something like that in the middle of one. So yeah, from what I was told in our previous discussion, it should take no more than 2 hours.
Okay.
That's like the cap.
Okay, good to know. And then here's a clarification around ICAP. If somebody scored within a certain amount of the cutoff for eligibility, there's an ICAP triggered for the following year. I'd have to look into that to give better information. I think if it's probably not an experience that a lot of us have, but I can write it down to ask the unit. Sorry, takes me a second to write it. Great communication. Thank you so much. Okay, I have asked if it will be a file review, but the assessor I spoke with stated there were many variables and just submit info, then wait. Yeah, we're the fail safe there is submit info. That's what we're here to talk about is that, people get confused when we say you got to figure out what to send and what not to send. This is already confusing enough. So we're just asking for standard information, as standard as possible, or at least standard understandings of what we're going to send in. It doesn't mean that it just means that they're, like I said before, the care coordinator does the same thing, whether the assessment happens or not. It could be file review. It could be our work that we do with the file review based on the info you send, or it could be an assessment. And yeah, there are a lot of variables. And some are 1 hour and some are 3 to 4 hours. Yeah. Well, we can check with our assessment team and see what kind of communication and what kind of consensus they have. Maybe we say it could take an hour or it could take up to 3 or 4, depending on how information is transacted during the assessment. Really good thoughts. Okay, why does it take so painfully long for the NFLOC unit to determine level of care on an ALI waiver applicant? The client was assessed March 13th, and I still don't know where things are at. No requests for additional documents from the unit. You are always welcome to contact the unit. You can contact the unit manager and ask into that, inquire. I know you know how to look at it in Harmony. But if you feel that there is a delay, I know we have regulatory description of time periods after assessment that SDS will, respond. But if you are thinking that there's a delay, I would say just to contact the unit manager. You could take a look at the file and see where it's at in Harmony. But if you're stuck, then you could contact them. I think they're pretty positive about interacting with you about that, with any care coordinator. So, okay. Well, thank you so much for your thoughts around this and interesting questions arising from it. We'll take a look into those things. May not have an answer right now today, but we'll research and do our best to clarify understanding around that. Anything else you want to add, Damon?
No, just thank you everyone for some of your guys' input and ideas or questions. Yeah, because obviously, like I said, this is intended to help all that are involved, especially families and individuals. All right. And I'm sure as this process continues to go through and it starts to get handed out, I'm sure there'll be more questions or maybe some clarifications. Of course, you can always reach out to us if it's something that needs to go directly to, the assessment unit or anything like that. We can always point you in the right direction. But yeah, thank you all for your guys' input and you guys' interest in this tip sheet.
Okay, great.
I'll go ahead and stop stop sharing now.
Okay, sounds good. All right, we'll go back to our agenda. All right. Just moving things around so I can see better. Okay. So more about assessment, just a few thoughts about the documents. This really helps, especially when a file review is at hand, it's time for a file review, or there may be changes in the person's condition and things like that. Our teams want to remind us that they need current and relevant information. And what does that mean? That means the most updated documents that you can get regarding the person's medical condition that would bring them into the waiver program. So it doesn't mean things like patient instructions, like aftercare and stuff like that, or every single note that there is about a condition that doesn't bring them into the waiver care, like if they wear glasses or something like that. We don't have to turn that in unless it's very much related to their disability that brings them into waiver. And so the person, and that's what we're talking about when we say current and relevant. We do have our application checklists online, which they've been around for a while. I'll switch to that screen in just a second. Initial and renewal for CFC, of course. And flock initial and renewal. And then ISW IDD initial and renewal. An initial renewal and interim application checklist for ISW and IDD. Our contact people for the two types of level of care for IDD, it's going to be Jenna Ferrali. So if you have questions about an assessment regarding IDD and person applying for ISW or IDD, you would get with Jenna. And for our assessment unit for nursing facility level of care, it's going to be David Chadwick and Eli Haroon. So those are your contacts. We'll give this out too when we send your email. We'll give you the agenda. So it has the links and the information. And then we'll take a quick look at our approved forms page, just as a reminder where to find the application checklist. I certainly have gotten some questions about, what are the rules around including this document or that document, and it was available on the checklist. So we thought it might be handy to just give a reminder about that and give you the resource. So let's get to that page. I wish I was faster on Zoom, but you know, Zoom is good. I like Zoom. It just doesn't share a lot of things at once. That's okay. It's probably better that way. Okay, so if we go down to our waivers and CFC, so you'll see application and then you'll see checklist, initial and renewal. We can look at one of them, and I think I have to share again. We don't have to look at them all this way, but I just want to share this one just as an example. Alaskans Living Independently and APDD and CCMC. Okay, initial application checklist, right? We'll have an inquiry within the last 60 days, active Medicaid eligibility,
Testing.
ADRC person-centered intake completion form, unless it's already on file in Harmony, APDD only, proof of DD determination, and that would be a person is registered with our DD registry. And the application, the attributes of the application that make it complete, Medicaid number being present, complete all the fields, use NA if the info doesn't apply, signed and dated, the rights form, verification of diagnosis, medical info, submitting in chronological order is recommended. And here's the specifics on that. Visits or consultations with medical professional within the 12 months preceding the date of submission of, I know it says renewal, but application, okay? I have to make a note of that. Medical documents related to the long-term care need. Records of residential stays, if any, therapies, records of therapies, right? Psychiatric or mental health counseling or treatments, records of those, and special treatments that the person has, records of those, and then outpatient treatments. Okay, so these are the kinds of records that would probably affect a person coming into the waiver program. Okay, legal representative documents. Okay, I think that's the bottom. Yeah. So these are supposed to be helpful in helping you to apply with the right kind of documentation for the person. Okay, there's one there for each different waiver type. Comments. If the application was sent 6 months prior to a scheduled assessment, it's a good idea, is a good idea, especially if health changed, to get updated medical records and or verification of diagnosis. And another hint, it should be 3 to 4 months old based on dates of submission. SDS needs to schedule timely assessments to avoid this exact issue. Agreed. And it is noted. For the DD side, is SDS going to verify the recipient has Medicaid prior to them being drawn for a waiver and receiving the letter to proceed? We actually run it. It has to get run through DPA at that point. We should be doing that. If you have experiences of us not doing that, then it might be helpful to email maybe Kat and myself, and we'll try to bring that forth with the unit. Okay. We should be doing that. Okay. I'm looking at your question. All right. Well, I see it seems like you want clarification about how the interaction between DPA and the waiver approval goes. So we could do that. Mhm. And you can definitely speak if you want. You can unmute and say whatever it is that you like to say.
Perfect.
Go
Then
for
here's
it.
what I would here's what I would like to say. This is Christine Culleton, and that is exactly not how your system works.
Okay.
You have refused to have the ADRC inform families when they apply for a waiver that they need Medicaid first. You have not had a referral process for that to happen. TEFRA applications are taking 6 months to a year. You're drawing individuals for waivers without Medicaid and then holding those slots open without any ability for us to get paid. But we're still expected to do every bit of the work required, submit a plan of care, do the level of care, do all the hoops, only to have SDS come back and say, we're now terminating the waiver because DPA hasn't processed the paperwork. So respectfully, I've been asking for you guys to incorporate this into the ADRC now for 3 years as part of their job. That would remove the burden of care coordinators taking on unpaid, uneligible recipients. But that's not what's happening. You guys continue to refer people over to care coordinators without Medicaid, putting the onus on us to do the heavy lifting and the work, which is outside of the scope of regulation for our job.
Well,
Just taking
Christina,
notes.
thank you. Thank you for your feedback on that. And that we do understand the frustration this has caused. And from what I am understanding, we as the training unit are trying to help you all as care coordinators to have a better transition while working with your clients and getting things done different. So I understand that you are frustrated within this matter, and when you have something like that, it would be nice to put it in writing so
We've
that
done
it can
this.
go to the right person. I understand, but I'm just saying thank you for your feedback on it, and I hear the anger, the frustration, all of that you have.
It is unfair for you guys at SDS to say one thing and practice another.
We totally understand that. And I think it's best to put it in writing so that they can have a trail.
Ma'am, we have done that repeatedly without any success or response, which is why I'm saying it today. And I appreciate your comment, but respectfully, it would be helpful if we could see action.
Okay.
I understand.
Well, thanks for bringing it up again. Okay. I've been here quite a long time now. We'll bring it up to our leadership team, and we also do some support with ADRC and DDRC. So we're hoping to resource them with, through their conference with different trainings. So we'll be able to support in some way, probably most notably connecting with our leadership team. Okay, hands up. I saw Denise and then Heidi. Go ahead, Denise.
Yeah, I just want to say that I'm just going to piggyback a little bit on what Christine said. The new thing I'm seeing with Medicaid is they're issuing a coupon after someone has initially applied for Medicaid. And then I go through my process, start collecting records, and then we get a letter saying their Medicaid application has been denied for X, Y, or Z. And my most recent one was over-resourced, which is really super easy to see when you get an application. So we are having generally an issue with Medicaid right now as pushing us into a system that we can do nothing with because they're not on it yet, being given kind of something saying, oh, they're ready. Right. So that needs to be addressed with DPA because it's a due diligence issue on their end that's affecting us. And it's the first I've seen of it. And I think a couple other care coordinators have mentioned it. Thank you.
Thank you.
Thank you.
And Heidi, go ahead.
I'm not smart enough to put my hand down, so I'm gonna have to figure that out. But what I was gonna say is, what I was gonna say is I've run into the same thing as Christine, And as Denise, and it's frustrating because this is what happens. These families are not eligible. They get sent this screening coupon that's like time sensitive. So they're calling us every week saying, hey, did you get everything in for this screening to be complete? Because Medicaid's issued a screening coupon, but they're still missing 76 things to qualify for DPA. And I'm like, no, I'm not going to submit the screening until you send the 76 things into the DPA. But there's still that, like, they got that letter, they have to have their waiver screening done by, March 15th. So they're calling my office every day. But and it is frustrating, but I will tell you the one thing that works, have the person write a letter and send it out to every state representative. That is the only thing that I have seen work, especially when you have cases where the TEFRA kiddos are not getting their DPA stuff done. I'm telling you, I had one that was waiting for 3 months. It was a little girl in a wheelchair, sent a picture of the kid and a letter, the family did. Next day, Medicaid approved magically. So, I mean, it takes a little bit of extra legwork, but if people are struggling and not getting their Medicaid, send letters out. That's what works.
Thank you.
you.
Yes, people are always welcome to advocate with their representatives. If people have things happen that are of concern to them and affect them, then people can definitely do that. All right. ISW is being drawn and they don't have Medicaid. Their waiver services are going unused until DPA approves them. You can't bank services, though they're just losing. Yeah, they're not approved at that time. They're not approved yet. I get you. And the snags between DPA approval and waiver becoming active. Okay, a hand up, Stephanie. Yeah.
I think
ahead.
I was going to make a suggestion about Christine's comment because I think a lot of us are seeing this happening, and part of it, there's a lot of reasons, but I think a lot of it could be relieved if the DDRC folks who are helping people get on the DDRR wait list had a mechanism as part of their procedure to make sure people are also doing those Medicaid applications,
Okay.
whether that's TEFRA. I think part of it too is some people kind of fell off during the pandemic and then didn't realize they didn't have Medicaid, or there's a lot. Yeah, there's a lot of, we're seeing a lot of different things popping up, but I think really if we could head it off right there. And I know our agency had a really good conversation with Stone Super specifically about that because we were seeing that being an issue. So I think that's really where it needs to kind of come from. I also wanted to just make a comment about the assessments and the medical records, because we've had some issues, especially with things taking a little bit longer. Plus, we're sending out those records requests pretty early in the process. And so, because we have to submit the application within a certain time frame, we have to send our records requests out in a certain time frame to meet the SDS deadlines. And so sometimes by the time those reviewers get, those assessors get to those records and look at them, and they could be kind of old records, right? And so, some feedback I've had from some of our care coordinators is assessors making comments in the meetings about how we didn't submit records that are relevant. And that's not a very fair thing to say when, we're having to work so far in advance to make sure things are and then on top of it, we have certain hospital systems and certain clinics that we have to submit stuff even further in advance just because we know it's going to take a long time.
Thank you. I'm just making a note.
Jimmy stated
Okay.
that they have a comment. Jimmy, do you know how to come off mute?
Yes,
There you go.
thank you. Same topic of DPA. I've had a couple of clients have the Medicaid coupon. They're not getting notices from DPA with forms, requests for information until the due date. They get the notices in the mail. It's the due date that they need the return of the documents before they even get the notice in the mail. And then the coupons are not giving enough time for me as the care coordinator to get done with what I need to do, ask for another coupon, and it's still not enough time. And then they're asking us to do the whole application again. It's just not enough time to get that, you know, the whole process done for Medicaid waiver. It's unreasonable.
That's true.
Gotcha. So I have lots of notes about the, juggling due dates, the different issues that have come up. And also that we need to better support our ADRC and DDRC in getting people knowledgeable about applying for Medicaid. This is not a super new thing. I've heard this before. Resources to help people apply. The situation with DPA, there's just been a lot of challenges coming out of COVID because all of a sudden people were renewing and they had to allocate staff to renew and things like that. Just a whole lot of sort of fallout from that. But our leadership is aware, so we'll bring those concerns forth and ask folks if we can, how can we support this to be a little bit easier or more reasonable. Okay, and then your thoughts about assessors. An assessor asked a family to go to YouTube for info regarding their child's diagnosis versus what they were told by medical providers. It is frustrating for the family.
Wow.
Good comment. I appreciate knowing that. We'll bring these up.
And
All
again,
right.
it's good if you, I mean, I know y'all already said this before and we have heard it before, but if you put things in writing and you're sending it to leadership or to your legislators, that is the number one way to get things turned around. We
Or for the
appreciate it,
assessors,
right?
we want the assessors to do, everybody wants to do a good job, right?
Right.
Everybody at SDS wants to do a good job. So if there's something happening where, it's not, I don't think anybody wakes up and says, gee, I want to give a family confusing information or be disrespectful about anything, but if they do something that comes off like that, you can email David or Eli, and say, hey, something happened and, I wasn't comfortable with it and the family wasn't comfortable with it. Help us do better too, directly with that unit, Of course, they'll hear from us, but if they have a more direct contact through your knowledge and your interaction with the family, then would you please help us do better by letting us know?
Right.
Mm-hmm. Okay. Heidi, go ahead.
I just have one more question. I recently have had some people get assessed over a month and a half ago, and I haven't seen the assessment results come back, and I kind of keep stalking Eli, and he keeps kind of kicking the can down the road and we'll contact the nursing unit. So today I was like, well, who do I need to contact? So then I sent it to Molly, but I thought there was only 30 days or something, because some of the people, they'll call every single day because they need to get, grandma into an ALH or something. So I just was kind of wondering if you guys had any guidance on how we can escalate, because I've even emailed Lauren and she's like, I don't have anything to do with this, Heidi. No, she didn't say quit emailing me, but she's like, I can't do anything about this. Why are you messaging me? So if there's a better resource to be messaging, that would be helpful, because some of them that get turned around in 3 days and it's amazing, and then some of them are taking a month and a half or 2 months. So
let me find out about that. I'm not sure who to point you to within the team for a better answer than Molly, who you already know about. That's who I would say, right? But if that's not a good answer, then I'd have to ask them.
This is Christine. I had one other question off topic, and I'm sure you can point me to it.
Uh-huh.
Can you remind me again why emails don't count as a contact? I know in regulation it's not there, and I know that part,
Right.
but the rationale behind it, I guess, is really what I'm looking for.
Okay, sure. The rationale behind it is that our care coordinator in-person visits have been reduced to 1 per 6 months from 1 a month. Those, the real time interaction of phone calling is what is the reason behind not having emailing be contact, is because we're looking after people who have nursing facility level of care or institutional level of care. And some people may email and some people may not. In any case, they may delay their email back to you by however long they want to delay it. So it's looking for a more interactive, I guess, faster response to the person.
Wouldn't the
And that would be a
balance,
phone call.
wouldn't the balance be to say in-person phone call as one of the contacts and to allow the recipient's choice as the other? I'm just asking because we have, I see all my folks, so that's not my issue per se, but they also email a lot.
Mhm.
And
Yeah, nothing says you can't email. I mean, you can certainly email. You can do all the emailing you
No, I
want,
get that.
but it's not the
it-
contact. So yeah. Go
I
ahead.
just was trying to understand your rationale. So your
That's the
rationale is,
rationale. Mhm.
okay.
That's the rationale. And it's interesting because everybody who I talk about this with says, well, I visit all my people, and it's,
Well, right. It's just, it just continues to be of interest to me because
Mhm.
I see both sides. I have individuals who communicate via text or
Mhm.
email. They don't like talking on the phone, so I go see them, which is totally appropriate and fine.
Mhm.
But it changes their dynamic and how they're choosing to communicate. It's not that I'm not compliant. I'm just curious as to why it's not more person-centered on the
well, no,
recipient side.
yeah, I get it. I mean, things have changed from years ago to now. I'm not saying it'll never change again. I mean, things have always changed. Support plans have changed. The rules around them have changed. Perhaps this will change. I don't know. I don't have any, insider intel onto that. I do get the feedback and I do provide the rationale, and that is the rationale, is that it's a more timely interaction with the person as opposed to an email where it could sit. And I cannot, I can't go forth with every single scenario that you might face for it to be a contact, but I encourage you to continue to do emailing with people who do that well, and do your visiting according to the reg and do your contacts according to reg. And that's what I have right now. But
Right.
your
And I
feedback for the
appreciate
future is
that.
always welcome. When the
I,
regs go out for comment, you can do that, or you could submit something to our policy unit, who's, they're a listening ear for changing of regs and things like that.
I
So
appreciate that. Thanks.
I just wanted to add too, I feel like, prior to COVID, we would do our one in-person visit each month. And then that second contact was however it happened, with the person or their POA, whether it was phone, in person, email. It seemed like it was, open to any way of, having some kind of communication with the person or their, POA or guardian.
mhm.
Okay.
Okay. All right, we have a few minutes left. I did see a note to talk about LEND, so I'd like to say that the LEND program is a Leadership Excellence in Neurodevelopmental Disabilities, I think is the acronym. We've talked about LEND before. LEND is openly recruiting for the next season's LEND cohort. The note says to invite individuals and families who or family members who want to participate in LEND as a fellow. And the LEND program carries that at the heart of it, is that it includes people living with disability and family members too. It's for professionals, but it's also for people with lived experience, and it's what makes it great. And I don't have a quick contact for LEND right here to, okay, Stephanie Hall says I'm open for questions about LEND, and I think probably Kelly McBride, who might be too. I'm just throwing it out there. I don't have a good link right now at the moment. But yeah, the LEND is looking for people. So and Lend is wonderful. I went to Lend, and it was very hard, but also very insightful and useful. Mhm. Okay, Full Lives still is accepting registration, and we have included links to the registration and their agenda. We don't have to look at them here. We'll send you this document so you can link to that if you need to. As
Also,
always, oh, thank you. Thank you, Stephanie. Go ahead. Yes.
if you're going to Full Lives, don't forget to come to our table and register with us. If you want to get renewal credits for Full Lives, just by you signing up for Full Lives, you will get 16 CEHs. But if you want to get your renewal credit, please come over to the table, register with us so that we can give you your questions. And once you get your questions, we'll give you directions on how to go on from there, how you will proceed. Okay? So looking forward to seeing you all at Full Lives.
Yeah, come see us. And Cassandra, you're right. We'll know who all is a care coordinator from the giant registration list that we get.
Yes.
And we'll pick everybody out, and we'll give you, we'll enroll you in a CEH certificate inside the training academy. So you can go in there. We might have a couple questions that you just click yes or no, and then you'll get a certificate. So, you know, everybody who attends is going to get a separate certificate from CHD. You know how they give you something, like a sheet that says you went there. It's not the same as the one you get from us for CEH. We're only issuing those to care coordinators. So if you're a care coordinator, you got to be in our LMS, which I'm pretty sure everybody is. Even new ones are in now. You got to be in our LMS, meaning Learning Management System, the Training Academy. And we'll give you a link. We'll enroll you in the certificate, and then sign up with us in person if you wish to use it as training and for your renewal. And that's only open to those of us who are care coordinators for 2 years or more. I'll say 24 months or more. So if you're brand new and you're within your first year, you're not going to do retraining this way. You're just going to do it the way we already have. But by attending and engaging with Full Lives, if you're 2 years or more in your care coordination career, you can sign up with us, get your questions. It's a fun assignment. Like I always say every year, it's a fun assignment about your experience with the Full Lives event. And then you will pass that, of course. Not by pass, I mean just complete it. And then you'll get a certificate of renewal training.
Right.
And
We'll
you'll
give
get
you
a
further
certificate.
instructions.
Yeah.
Once you get there, we'll tell you exactly
Mhm.
what how to find
Yeah.
it and stuff. But we appreciate you for signing up and coming to Full Lives, and
Mhm.
we're looking
Come
forward
see
to
us.
have a good time with you while you're there.
Yeah, it'll be great. And then just the reminders about our individual and family quarterly information sharing webinar. People do not need to pre-register, just show up. It has the sessions. That is we talk about eligibility. It's kind of the number one topic. And we do Q&A. Our provider monthly info share is still available as well for all provider types, including care coordinators. But our vision here is like if you're working with a provider and you can help share that info. We have our office hours, which our care coordinators, of course, are welcome to continue to come for support, provider support. You can also come for care coordination concerns or send providers to us if they're struggling or they just need more information. We have our YouTube channel, and a policy now has a YouTube channel, and of course our training academy that you know about. And I don't see it listed here, but we do have our family. We do have a family office hour. I'll put it on here when I send it out because we're happy to welcome families to our office hour. It's we just did one. I'm not sure if it would make it the second
I
be
think
the
it's the first
Tuesday,
Monday,
first
Kara,
Monday. Yeah.
but Monday was a holiday.
Thank you. Yes. Right. The first Monday and I think the fourth one, but there are 2 a month. I'll send it to you. And it's just nobody has to pre-register. They can just show up. And we did have a family member come, and it was just wonderful because the care coordinator came with them and we were able to sort of talk through what the concerns were. And we just really appreciate that. So we're there to support individuals and families on your behalf too. And AADD is looking for more care coordinators to join, and there's a link in the chat. And Heidi, go ahead. Sorry, it's right on the hour. Go ahead, Heidi, you have your hand up. Is that right?
Sorry, I
Maybe.
couldn't get myself unmuted. Quick question. Did you say that the using the full lives for the educational requirement would not count for care coordinators with under 2 years of experience? That's what I was a little confused about.
Right. You have to be 2 years or more as a care coordinator. You have to be certified for 2
Okay.
years or more to be able to go to Full Lives and do our little assignment. Or I should say our fabulously interesting short assignment. And use it for renewal training.
Right.
Go ahead,
But they
Cassandra.
could use the 16 hours CEHs. They can use that,
Okay.
but they can't do the
Okay.
renewal part. Okay.
Okay, that was my question. Thank you.
Mhm. Okay. Well, thank you so much for this lively conversation. I got lots of good notes. Really appreciate being able to work on these things together with you and your great information. Appreciate your passion and concern for people we serve. I love that. And we'll let you go for now. Okay. We'll catch up with you next time. Next info share, or hopefully you can come to an office hour and say hello and bring your questions. All right. Thanks everybody, and goodbye for now.